another country which, of course, has been deeply ravaged by this new Omicron variant. Dr. David Nicol, of course, is live with us from there. Dr. Nicol, what were the indicators of the new variant? How did you manage to detect it and isolate it? Dr. David, I think you're on mute.
Sorry, it's great to join, and actually, just after hearing Dr. Coetzee, because actually, you know, the whole world is grateful to South Africa for their transparency, and you know what we have learned about Omicron is it's very, very transmissible, and in the UK at the moment, the number of case numbers has gone up hugely, and we are seeing an increase in hospitalizations. As yet, that's not necessarily being translated to increase in IQ numbers, but that is our concern that that's going to happen. And you know, there's a lot of anxiety we have in the Doctors Association, because I know, speaking to colleagues in critical care, that we don't have the same numbers of staff as we had 12 months ago in critical care, and yet we're planning to build surge wards whilst have New Year's Eve parties tomorrow night. It's just crazy.
Yes, I have to ask you also about the United Kingdom's experience then with the Omicron variant. You know, did you find that the symptoms were different? How did United Kingdom deal with this new variant? The cases are obviously still high. They've not receded there just yet. What does this say about this variant then?
Well, so far, although you know, it appears to be milder for those people who are vaccinated, the worries that we have got, I work in Birmingham in an inner city area, and although you know the vaccine program has been fantastic and we're encouraging people to get the boosters and things, there are you know pockets, particularly in inner city where you have diverse communities where there is a lot more vaccine hesitancy, and our real worry is those areas where in some cases you know anywhere near as many as half the population haven't had any vaccine, let alone a booster, and if you've got a very transmissible variant, you know that's a real worry that we've got, is the effect that can have on that population.
Right. Also, you know, what has been the UK's experience with boosters? Did you find then, as you're saying, you're encouraging people to take them, did you find that they helped in moderating the severity of the disease?
Well, I think that, you know, it is so important that people do get their booster, and I think my worry is more for the people who haven't had any vaccine at all. But I think the boosters, because we see that there is waning, you know, after 3-4 months or so. So it's really, really important that people do have the booster, you know, when offered. But you're seeing a divergence, and you know, I personally live in Worcestershire, which is a more rural area, less, you know, essentially less ethnically diverse, and the vaccine rates and the booster rates are fantastic. Whereas if you look at the more diverse inner city areas, the booster rates are a lot less.
Okay, and you know, is the UK, Dr. Nicol, considering then a fourth jab as well after Israel and Germany gave a green signal?
I think I haven't seen anything about that yet, and
okay.
In some ways, what we probably need to see is vaccines that are better at dealing with this, because the vaccines clearly work in terms of reducing severe disease, both in death and intensive care. But what we actually want to do is, you know, stop people getting sick and stop it transmitting, so that we can get back to, you know, normal lives. And I'd mimic what Dr. Coetzee said. It isn't just about the vaccine. It's also about our behaviour. You know, using decent masks, this kind of thing really makes a big difference. And you know, a criticism that we would have of the UK government is the complete focus on boosters, which yes, that's important, but actually we do need to think about the other aspects, that this is an airborne disease. Using proper PPE to protect both your healthcare workers and also in the community can make a big difference as well.
Right, and you know, before we end, what are the Omicron protocols in place in the United Kingdom, Dr. David? Are patients being asked to self-isolate, and you know, how is the hospitalization rates of this new variant been like?
Well, that is going up, and also that's having an effect in terms of staff sickness, and that's actually one of our biggest worries at the moment. I mean, if I'm looking at the figures from NHS England for London, which is essentially the epicenter of Omicron at the moment, but that's, you know, staff absences went up from 1,100 to nearly 4,000 in a fortnight. Okay, so and that's a real worry with the government, particularly when we head into the new year, which is traditionally always a very strange period. If I think back to last February, I'm a neurologist, okay, and we were running out of ITU beds last February, and I was having to see people in operating theatres where normally that's where a patient who had cancer, who'd been operated on, and we're actually having to use that for extra ventilator capacity. So that's the real worry, is that Omicron has a knock-on effect on the whole healthcare system. At the moment I've got a colleague who's waiting to fly back from Pakistan who can't because the plane's been delayed. Mm-hmm. The pilots are isolating. So this is a global pandemic which is affecting every single aspect of our lives. But we need to learn a way to live with this, so that get your boosters, and wear proper FFP2 masks and things.
Okay. Final question then: what are the big takeaways, for the UK from this last Omicron wave is concerned? What's the takeaway from the United Kingdom experience that you can share with us?
I would actually mimic exactly what Dr. Kutsay said: is we need to treat people like adults, and actually engage, with those communities that are anxious and things as well, that actually and we need to get around the politicians somehow or other to get people to learn to live with this. Get your booster is just a routine part of good healthcare. If people have got concerns about that, explain the reasons for that. And as I see lots of my neurology patients who maybe have anxieties. Is this vaccine going to worsen my neurological conditions? And the evidence for that is no, basically. Yeah. So having those kind of conversations, but also not just about vaccines, about wearing a mask when you're out and about, watching a distance, avoiding crowds when the prevalence is very, very high. A lot of common sense things, basically.
All right. Well, let's leave it at that. My thanks to you, Dr. Nicol, for joining us on the broadcast from the United Kingdom. We've